back to Meds Made Easy. My name is Tarun. Today we're going to be talking about Ondansetron. Yeah, it's quite a mouthful, right? It's also known as Zofran. Now, it is indicated for nausea and vomiting. Now, there are some off-label uses as well for things like vertigo. It's kind of like it can be used for a lot of different things, but mainly using it for any kind of variation on nausea and vomiting, whether it's related to like chemotherapy, any kind of surgeries. I've seen people take it for hangovers. So it is a very, very versatile drug. It's a 5-HT3 receptor antagonist or a blocker. Essentially what that is that's a form of serotonin. In your vagus nerve, you have a bunch of receptors that control the vomiting and the gag reflex in your body. This essentially blocks and cuts that off so that you don't feel nauseous, you don't vomit and things like that. Very effective, very, very, very effective. Let's see here, it kicks in within 30 minutes, very quick, especially if you have the oral disintegrating tablets or the films. Those are even quicker. But if you just take the regular tablets within 30 minutes, within 2 hours it peaks, meaning you get the max effect of the medication within 2 hours of taking it. You don't need to worry about meals with this one. They say that there's a slight increase in the concentration if you take it with food, but if you think about it, you're taking it because you can't hold down food. So if you take this with food, there's a good chance you might throw it up. So either way the manufacturers go, it doesn't matter if you take it with or without food. The absorption levels are really kind of negligible. They're not too far off from each other. If you're pregnant, you can take this medication. It's a pregnancy class B. Lactation, they didn't really have any information on that, lactation being breastfeeding, for those who don't know. If you have liver issues, you generally do not take this medication because it goes through your liver. But always make sure that all your doctors know about the different medications you take. For those with renal issues, I think you can still kind of take this medication unless you're in like severe renal failure. I'm going to put up a list of side effects here. Again, pretty wide range of side effects you can have with this medication just because this medication can kind of do a lot. The biggest one you're going to watch out for is constipation, headaches, malaise, malaise being like fatigue, like extreme fatigue, and things like that. So those are the things you kind of want to watch out for because it is kind of a downer in that sense. People taking on cruises, and same thing, it'll kind of just make you sleepy, and that's how it kind of works, is it prevents you from being completely active, kind of turns your body off a little bit. This way you don't, the gag reflex isn't really activated and at its heightened effect. So I think that's it, guys. Really, really easy medication to take. There's not too much to really get into it. I talked about the food thing. You can take it without food. It'll kick in really quickly. And then just kind of watch out for some of the side effects because it's an old medication. It's very good. It's very effective. But at the same time, you do tend to see that side effect profile. So just watch out for that. Guys, if you have any comments, concerns down below, hit subscribe. Let us know how we're doing on the page, guys. All right, I'll talk to you later. Bye-bye.